Good evening, my dear PG. Now I'm back with another chapter in nice to know areas. Today we talk on surgical safety checklist by WHO. What is surgical safety checklist? Basically, it is a communication tool that is used by the nurses, surgeons, and anesthesiologists to discuss important details about each surgical case so that the hazards to the patient is minimized. Now, what are the essential objective of creating this surgical checklist by WHO? There are overall 10 objectives. Number one, the team will operate on the correct patient at the correct site. So, doing wrong operation and on the wrong patient will be avoided. Number two, the team will use methods known to prevent harm from administration of anesthetics while protecting patient from pain. So, patient profile will be taken in account, and anesthetics which will be used will minimize the harm and will also protect the patient from pain. So pain relief will be one of the objective. Number three objective, the team will recognize and effectively prepare for life-threatening loss of airway or respiratory function. So patient profile, if we know earlier, we can always think in which way we can avoid loss of airway. Number four, the team will also recognize and effectively prepare for risk of high blood loss in difficult cases like placenta accreta syndrome or in severe eclampsia cases where there is chance of high blood loss. Objective 5, the team will avoid inducing any drug which patient is allergic. The team will also consistently use methods known to minimize the risk for surgical site infection. Number 7, the team will prevent inadvertent retention of instruments and sponges in surgical wounds. The team will also secure and accurately identify all surgical specimens. Number 9, the team will effectively communicate and exchange critical information for safe conduct of the operation. Number 10, hospitals and public health system will establish routine surveillance of surgical capacity, volume, and result. Overall, this objective means we need to know about the patient profile and then minimize the any surgical harm which can be done to the patient. The basic aim is to reduce the harm. Now, what are the advantages of surgical safety checklist? This checklist definitely helps in giving appropriate antibiotic administration, prevention of hypothermia, availability of equipment in operation room, and communication safety culture, because all this is a communication tool which is done between the anesthetists, surgeons, and the nurses. So you communicate among each other and to have a better, safe surgical procedure. It also reduces specimen problem loss and wrong test, inaccuracies in documentation, surgical related complication, mortality, and morbidity. Now, what are the elements of surgical safety checklist? Now, one is sign in, another is time out, another is sign out. Now, sign in is what? Sign in is done before induction of anesthesia, and confirmation is done about the patient identity, the surgical site, procedure, and the consent. So all the team members confirm that patient has been identified, the surgical site has been identified, procedure has been identified, and the consent has been taken or not. The surgical site, wherever it is applicable, is marked or not. The pulse oximeter is on the patient and is functioning or not. All members of the team are aware of whether the patient has known any drug allergy. The patient airway and risk of aspiration has been evaluated and appropriate equipment and assistance are available. If there is a chance of any blood loss, then appropriate access and fluids are available or not. These are to be done before inducing the patient. Now, what is time out? Now, time out is done before skin incision after anesthesia. Again, the team confirms that All team members have been introduced by name and its role, like surgeon, assistant, sister, anesthetist, chief anesthetist, and their assistants. All of them have been introduced by name and role. They again confirm the patient identity, surgical site, and procedure, reviews the anticipated critical, if you are taking any serious patient, what are the possibility, whether the you will be doing this surgery or you will extend the surgery. Everything are to be discussed after, before the skin incision. Surgeon reviews the anticipated critical and unexpected steps that can be taken. Like if you are doing a laparoscopy and it may be converted into laparotomy, so you will be telling, or if the plan is for laparotomy and hysterectomy may be needed, something if you are thinking, that also is to be anticipated and told. Now, time out. Anesthesia staff reviews concerns specific to so anesthetic themselves, they review the patient concern specific to the patient in view of anesthesia. A nursing staff reviews confirmation of sterility, equipment availability, and other concerns. So that also is, if some instruments are missing or necessary, it is there or not, has to be confirmed before giving the skin incision. Prophylactic antibiotics have been administered or not, has to be confirmed before skin incision. And we confirm all the essential images, lab investigations are there and displayed before skin incision. Now, sign out. Once the surgery is over and the patient is leaving the operating room, there is again a documentation of name of the procedure recorded. So what is the operation proposed and operation done has to be recorded clearly. The needle, sponge, and instrument counts are to be complete. That has to be written, and the specimen is correctly labeled, including with the patient's name, and whether any issues are there with the equipment are to be addressed. So if equipment is defaulted or some instruments are not working, that has to be addressed as a debriefing. The surgeon, nurse, and anesthesia review allow the key concerns for the recovery of the patient. If the patient is going to recover nicely, that has to be also told. If the patient requires some special care in post-operative work, are to be identified and reviewed. Thank you so much for listening to this chapter.